All right, on to Nasarawa State now. We've got Dr. Ikrama Hassan, who is the Chief Medical Director, Dalhatu Araf Specialist Hospital, joining us from Lafia. We also do have Dr. Joshua Moses, the President, Association of Resident Doctors, Nasarawa State. Gentlemen, good morning, and thank you both for joining us today on the program. Dr. Moses, let me start with you. The ARD embarked on this 3-day warning strike. You say to press home your demands, part of which is unilateral suspension of the residency training program, victimization of your members, and the list goes on. But we equally understand that the authorities did reach out to ARD, your team, asking you, let us talk. But it appears as though that was rebuffed and you went on strike. Is that the case?
Channel Television, good morning, the CMD of Dalhatu Araf Specialist Hospital, Dr. Ikrama Hassan. Well, we were called upon to call off the strike, but then there was no offer on the table for us to call off the strike. Our demands were simple. For us to call off the strike, we should be able to have something at hand to be able to reach out to our members. This is the reason why we're calling off the strike. And one of the things we requested for was that there should be immediate reversal of the residency training that was suspended earlier by the management. So if we had that at hand, we would have been able to reach out to our members and see how we can call off the strike before it even began. But you're telling us to call off the strike without having anything at hand. I think that's not proper.
No,
Thank you.
I thought they said, let us have a conversation and see how we can sort this out, because your strike is a 3-day warning strike so that they can address the problem, isn't it? So what happens after the 3-day warning strike?
Well, we'll keep on negotiating. We'll keep on talking to the relevant authorities and the relevant stakeholders. We've been trying to address this issue even before the strike started. There have been quite a number of things on ground. Our members were not happy with what was happening. There's been obvious or clear victimization of our members following the action we took to protect our lives and the lives of our families and that of the public against COVID-19 virus. And because of that, our members were penalized and victimized for that action we took. And it's quite unfortunate that that led to the suspension of residency. That also led to...
All right, just hang on, Dr. Moses. Just hang on a minute. Let's quickly bring in Dr. Hassan before we go to break. Well, did they have to go on a 3-day warning strike? Because he says they've been talking before they decided to go on strike. So apparently you forced them to embark on the strike. Can you hear me, Dr. Hassan?
Okay, I didn't get the last part of your question.
Okay, I'm trying to see if we could do this because we need to go to break. Okay, you know what? We'll come back to you in just a moment when we return. So please stay with us. Welcome back. Dr. Hassan, could you go ahead and respond to that? Because, I mean, Dr. Moses, they say that they had been talking to the authorities before they eventually went on strike. So does that suggest that the authorities left them with no option but to embark on the strike?
Thank you, Chamberlain, for the opportunity for us to give our own side of the story. And good morning, my energetic ARD president, Dr. Joshua. Actually, we feel as management that this strike was preventable. It was actually uncalled for. What led to the strike actually was the action of some of the unions in the hospital. We are in the middle of COVID-19, and then we had some misunderstanding on how some things should be approached. And ARD thought of a particular way it should be approached. And the committee that we had that was advising the hospital did not think so. So ARD went ahead and suspended services completely. And it became an issue between the ARD and their teachers, that is the consultant. One of the things that ARD did almost immediately is to say they suspended all academic activities in the hospital. And academic activities are anchored by the teachers. So I have the communique from ARD that said all departmental activities should be suspended in the hospital. Then the other organization, the other union, that is the MDCAN, Association of the Consultant, came out and said they will maintain services in the hospital. However, they saw it as an affront for their students to suspend academic activities unilaterally. And they said they are no longer going to train them. So we, as parents, the management, we now came in. I remember we're in the midst of COVID-19, we're having rising infection in the community and even within our own staff. We do not need that distraction. So we set up a committee. ARD has suspended academic activities. MDCAN has suspended residency training in the hospital. A committee was set up and we are given 4 weeks. Look at the circumstances surrounding this suspension and counter suspension. How do we avert future occurrence? And in their 3rd week, and that is what we're telling the ARD. Let's see what will come out of this committee. It's just next week we're expecting the report, so that we would have a more robust residency training in the hospital. Within this COVID-19 period, we're having shutdown of services or withdrawal of services by ARD for the 2nd time. We need to do something to protect our people, to protect our own staff during this pandemic, and to protect the people of Nasarawa that need to come to the hospital to access services.
Hassan, while Dr. Joshua...
It is actually an in-house.
Right. While he admitted that, there have been talks, and he said that they had to go on this strike because nothing was put on the table. That was the expression he used, that nothing was brought to the table. That's the impression we have. So you say that there have been talks, but he's saying that, yes, there were talks, but nothing was presented. So really, have you presented anything to them saying, well, this is what we're ready to do, this is what we might not be able to do because of these reasons? Have you been able to do that?
We had a meeting with them 3 days ago. This warning strike started 2 days ago. We had a meeting 3 days ago with the deputy governor of the state. And what he said, and it was generally agreed, that you people were wrong in relation to the MDCAN. Apologize to them sincerely. We will ask the management to reverse all those decisions. And then in return, he also requested that don't go on this warning strike. It was offered, and they refused it.
Was offered was based on a condition, right? It was conditional. Is that what you're saying?
Sorry, come again?
I said what was offered was conditional. If you do not apologize, then you do not get this. Is that what you're saying?
It wasn't conditional directly, but we are dealing with people's lives here. And our decision was, we have a committee. You suspended this training by yourselves. We didn't suspend it. And there was no thing to show that they have even resumed or they're even willing to resume. So we didn't suspend the training. They did it. So there was an offer.
Dr. Moses, I've seen that all of the time that we cut to your face, you were smiling all the while. Are there things you don't agree with that you heard the CMD say?
Well, as much as I wouldn't initially want to drag our trainers in, but then, like I said, this issue started when the 2nd wave of COVID-19 had hit our members. Lots of our members were beginning to get infected. We approached the management as to things that could be done for the infection to be able to be curtailed as quick as possible. We approached them severally, but then their response wasn't satisfactory. A lot of our members were coming down with the infection. We, as doctors, were now becoming risk to our families. We, as doctors, were now becoming risk to the public that we are supposed to be offering help to. And because of that, and the management was not responding to our plight, and our members became agitated and then became worried. And that was what led to the initial communique that our able CMD is referring to. The communique was not to insult or to make anybody feel less of himself or less important in the management. However, it was to be able to curtail or to break the chain of transmission amongst our doctors and also among our members, the public, and also members of our family. And that was what led to the communique. But after which, we were called, and then we were told that, the action we took wasn't so nice. And immediately we were able to call back our members to see how we can resume work optimally. And after which, we also had the national body speak to the CMD, and on several occasions, they even pleaded on the action that was taken, even though it wasn't the nicest of choice. But however, this was survival for our lives, survival for the lives of our families, survival for the lives of the public. And I think that was at that time the necessary thing for us to do. And we had already apologized, not just to the trainers, we had also apologized to the management. And aside all these things, it's like they were just waiting for us to make that move, and then other things follow simultaneously. Just about that time, the trainers went ahead and suspended residency, which on their own, as a union, as an association, they don't have the right to. And following that, the management, who is supposed to be the moderator or the overseeing body, now went ahead and obliged them in suspending the residency training. As if that wasn't enough, they had to recall most of our members that were in training elsewhere in other institutions as far back as Kano, Kaduna, Lagos, Enugu, and all that. They had to recall all of them back. Mind you, most of these people don't have accommodations back here in Lafia. So most of them were called back and were more like refugees in their own training institution. They don't have houses, they don't have place to stay. Most of them had to be staying in the common room and the core rooms and all that. And I think that this wasn't uncalled for. And even at that, members that were also supposed to be due for their medical postgraduate exams were also not allowed to sign for the exams. If this is what we get for protecting our lives and protecting the lives of our members, and protecting the lives of the public and our families as well, then I don't see the reason why these punitive measures should be meted upon us for protecting our lives. And mind you, our members, our family members also now began testing positive for this same coronavirus that we were trying to protect our lives from. And the result of what we did, or the action we took, even though it might be taken with a pinch of salt, but yielded great results. Since we took that action, I mean, the management can attest to it that there's not been that spike in testing, in COVID-19 positive cases in our institution. And I think that's a great win. And instead of the management or the government to praise us for the action we did, but rather we have been meted upon with victimization and then penalization of our members for a crime that wasn't supposed to be meted with such punishment. And I think that's not fair. I think that's not nice at all. We've apologized. The national body has apologized to the CMD and other relevant stakeholders. Other people have also came into the matter and then see what they can do. And up to now, there's been no fruitful, or there's been nothing positive coming out of it. So I don't know, what else can we do? That was what led to our members, the outburst of this warning strike that we're seeing currently now. It's just a 3-day warning strike. We keep on negotiating, and we're hoping that even though the ultimatum of 2 weeks is already up.
Well, Dr. Hassan, having heard him there almost 5 times, he said they have apologized. So clearly, it looks as if they've been able to identify, understand that, okay, well, it might have been an error to call that strike. Consultants may not be happy, but if they've apologized, and he said that several times, isn't it time that the authorities then say, okay, well, as fathers or consultants, professionals, we'll see how we can sort this out, because we need to think about the people who will suffer when all these things go on. So why are we still at loggerheads with this?
Thank you very much. Really, how this thing started is we don't have any problem with ARG at all. If anything, we want a situation whereby the training program itself will be strengthened in the hospital. I will not have a repeat of this within this period. A few months ago, during the pandemic, first wave of the pandemic, something similar happened, that we had a standoff between ARD and MDCAN, and ARD went on strike. That is not healthy for the system. And then within a few months, we are also having it. we are getting these things wrong in the way we are treating some of these things. So our understanding is we should come and sit down together to understand where the problem is so that next month we're not going to have another issue of ARD suspending another thing or going on strike. I wouldn't want a situation whereby today we'll just say, okay, sorry, everybody goes. And the real cause is not even known. What is causing all these things? It is true that the NAD had spoken to me. And I agreed quite well. It was NAD and the chairman House Committee, a Federal House Committee on Health. And the decision at that time was NAD will come to Nasarawa State so that we'll sit down together with the ARDK and understand what is happening to avert future occurrence. And I invited the NAD president to come so that we can sit down. And the feeling that I had is they asked him not to come and they declared strike. And despite that, we were now called, we had a meeting. This committee that we had set up, it was to work for only 4 weeks. If we had wanted punishment, we would have asked the committee to work for 6 months. Just 4 weeks, and it is already in its third week. So that we will know what the problem is. How can we solve it? How can we avert future occurrence? So we are all out for talks. Sir.
Dr. Hassan, just a moment. Perhaps there's something you said the other time, and I hope that perhaps that would help to nail the coffin on the problem permanently. Clearly, even from the very first comment you made, you referenced the issue between MDCAN and ARD in Nasarawa State. Perhaps there is a management problem, right there for the management of the organization to deal with, because if the two unions are not, on the same pedestal, definitely it's going to affect operations. Are there conversations you are having with the two unions together in order for everyone to see that we're all on the same page, working towards the same goal? And what are the challenges that you have seen as to why they are not able to work together?
Exactly. Now, this is a medical training program. And everyone that knows medical training program knows there is a structure. It is a relationship between a trainer and trainee. Trainers being the consultant and the trainee being the resident doctors. And so there should be a hierarchy. If that hierarchy is not, it's not like servant-master relationship, no. Trainer-trainee. If that hierarchy is not there, you are going to have a lot of problems. And those problems usually appear in people's lives, either in your health or in death. So that relationship is problematic. And we have spent maybe the last 2 years trying to bring it to focus so that we'll correct it. The last time that we had this problem, we sat down with all of them. And we thought that we have overcome it. Now it has appeared again. That is why I even invited senior trainers from places where residency training is well structured. It is running very well. Come, let's sit down together and discuss this issue. And ARD is running away from it and declare strike.
Meeting scheduled, or will there be anyone as soon as possible so that all parties involved can come to the table and discuss this matter?
I told you, we just had the discussion like 3 days ago, where I just said we had discussion 3 days ago where these things were discussed. And then ARD went on strike the next day.
Well, Dr. Moses, what say you on that one now?
Well, like my able CMD said, there is a structure. And when two unions like this, the ARD and MDCAN have issues, well, we are all affiliates of our parent body, which is NMA. And NMA is supposed to be the moderator in this case to be able to sort out whatever difference. But for the records, ARD as an association don't have any formal issue with MDCAN as an association. There may be pockets of issues with consultants and residents, but not as ARD and not as MDCAN. And if at all the problem has escalated to what we are hearing now, that ARD and MDCAN have issues, then I think there's a parent body, which is the enemy, that is supposed to come in and settle this issue. And
so is there any...
The enemy also came in.
Sorry to jump in. Is there any meeting? Because he's talking about the meeting that was called. So is ARD scheduled for another meeting with the authorities to address some of these issues raised?
Well, we're open to that. We're open to that because nobody wants agitation has always been the last resort when there is any crisis, any form of crisis. We're open to whatever meeting for negotiations or for things to be sorted out as quick as possible. We just want the right thing to be done and then sanity to be returned back to the system. And our members and the public should also be able to get the best of quality care, health care that...
All right, gentlemen, we hope that all parties involved can indeed come to the table and discuss these matters. Whatever might have gone wrong, people at the end of the day want to see everyone working together so that it doesn't get any worse than the COVID pandemic has already made it. So please, we hope that both parties will address it. So I want to thank both of you, Dr. Joshua Moses, President, Association of Resident Doctors, Nasarawa State, as well as Dr. Ikrama Hassan, Chief Medical Director, Dalhatu Araf Specialist Hospital. Thank you both, and we hope to hear from all of you that all of this is sorted in a couple of days.
All right, thank you very much.
Thank you very much.
All right.